Good evening, everybody. I'm Dr. Howard Elkin, the medical advocate, and tonight we're going to focus on men's health. You may recall that last month, which was in May, we focused on Women's Health Month. That's how it normally runs. And then a month later, here we are in June talking about men's health. Now, this is not really a new concept. It began in 1992, which is 32 years ago, and it was to actually detect and treat diseases relative to men at an early stage, because really men had kind of not, they've been behind women when it comes to actually getting treated for disease in general. As you know, there's a difference in lifespan. Women live on the average of 7 years longer than men. So why is that so? Well, there's been a myriad of reasons suggested, but we don't really know for sure. But we're trying to kind of narrow that gap. And it's really funny because back in 1992, I was a young doctor in practice, and literally at that time, for a man to see the doctor, he was usually in the ambulance with chest pain on the way to the hospital with a heart attack, and that's how it was. And fortunately, things have changed. But back then, I mean, women still remain to be the purveyors of healthcare in this country, and but so in the early days, I really would see a man by himself. Women would kind of drag the guys into the office to be seen by me. But things have changed, especially in my practice, because I'm known as a holistic-minded doctor and very preventive-minded. I see men at much younger ages than your average cardiologist. The average cardiologist sees people in their 60s and later stages, but I see people younger because people are more interested now in preventative health, which is really a boost. But I like to always give you a historical perspective and statistics to kind of set the record straight. So nearly 400,000 men die of cardiovascular disease every year. Now, that's according to the Center of Disease Control. That's really 1 out of 4 men. And more than 700,000 men will develop some type of cancer in the next year. And about 300,000 of those will die of cancer. That's according to the Men's Health Resource Center. Now, 230,000 men each year are diagnosed with prostate cancer. That's 1 out of 9. Now, if you look at breast cancer, that's 1 out of 7. So prostate cancer, 1 out of 9. Okay. And the most common cancer is prostate cancer, followed by lung cancer, and then colorectal cancer. The most common cause of death in cancer patients really is lung cancer, followed by prostate cancer. So it's big, it's major. So here's some other facts that you may not know. Mental health, which is really a big topic for me. Inactive men that do not exercise, are more than 60% more likely to suffer from depression than those that exercise on a regular basis. And that should be no surprise. If any of you saw my recent video on social media about stress reduction and what you can do about it, the very first thing I mentioned is exercise. It's the greatest deflector of stress that I can think of. So really, inactive men do poorly, suffer more depression compared to active men. And what about sleep? Men that sleep 7 to 8 hours a night have a 60% less risk of a heart attack than those that sleep 5 to 6 hours a night. So it really makes a difference. So how are we doing? Not so great, really. Men are still less likely to seek health care than women. In fact, women go to the doctor twice as often as men do, okay? And 40% of men will just kind of hang out until they're really, really sick before they seek care. They just tend to be not as proactive, okay? And mental health is still very stigmatized in the American society, but yet 30% of men suffer depression. So, although we don't talk about it, it's there. So being a cardiologist, I always like to start off with heart disease. I just told you that, 400,000 men die of cardiovascular disease every year, and most of the cause of death are coronary artery disease, which we've discussed this in detail during Heart Month in February. The average age for a heart attack in a male is 65, and women is 75. But here's the thing that you got to know. We're seeing more and more younger people develop heart attacks. Like up to 10% of heart attacks are now seen in people under the age of 45. This is males under the age 45. The bed, and that's important. And why is that happening? Well, high blood pressure, diabetes, metabolic syndrome, obesity, less activity. So men today are not as healthy as men in earlier years. What else about heart disease? Heart failure is more common in men than women. So heart disease is still very common in men, and the important thing I tell people is know your numbers, know your blood pressure, because most people don't even know they have hypertension, and most that have it are not adequately treated. It's so the number one risk factor for heart disease. So you got to know your numbers, and you got to check them frequently. And when it comes to hypertension, and I talked about this during Blood Pressure Awareness Month, which is also in May. For every pound you lose, okay, for every pound you lose, you drop about a half a millimeter of blood pressure, both systolic and diastolic. I say, what's the big deal about that? Well, if you lost 10 pounds, you would drop 5 points in your blood pressure. If you lost 20 pounds, which a lot of my hypertensive patients could afford to lose, we're talking about 10 millimeters of mercury, both from the top and the bottom number. And it's really important because most drugs don't do any better than that. So it's important. Now let's go over to prostate health. The prostate cancer is usually increases with age. Usually we see it in 60% of prostate cancer is in ages in males 65 and older. What about screening? That's the important thing. So we usually start screening at age 50, okay, for the average person with that's at risk, for average risk. But if there's a family history of prostate cancer, or we're talking about African Americans, we usually do it at an earlier age, like age 45. And if you even have a higher risk, more than one first degree relative, then I would probably do it at age 40. I usually do it at 35 to 40. I'm probably a little more cautious than the average person because I'm also proactive, preventative, and I do a lot of work with hormones. So it's important to know your risks. So prostate cancer should be at least checked, prostate PSA levels at least annually. What about prevention? Okay, well, it's always goes down to what you eat, right? You are what you eat. So tomatoes and colorful foods like watermelon that have lycopene, very good for prostate health. Fruits and veggies, lentils and green tea. These are all very healthy. Really, just a healthy diet and unprocessed foods is going to help prevent cancer of all cancers. Healthy fat, quit smoking, don't drink, exercise. Nothing new. But what about colon cancer? Also common in men, especially if you have a family of personal history, colon cancer, not consumption of red meat and processed meat. Now, the red meat thing is not quite so clear to me. Processed meat, yes, processed meats are really, really important to avoid bacon, sausage, cured meats, deli meats. I try to avoid them. I really do. Low calcium intake. Low intake of fruits and vegetables, low fiber, physical inactivity, obesity, lack of exercise. So all the same things that we talked about with prostate cancer pretty much run the same thing with colon cancer. So the prevention, healthy diet, exercise. What about screening? Well, we usually have your first colonoscopy at age 50. But when Chadwick Boseman died at age 37, he was an African American actor, Broadway actor, as you well know. They really kind of changed things. So now it's like age 45 should be maybe your first colonoscopy, and even earlier if there's a strong family history. So it's not that Black African Americans are more prone to a colorectal cancer, but they're more prone to more aggressive forms of that cancer. And same thing with prostate cancer. So um, we really, for that population, we need to be a little more aggressive. Now, let's talk about fertility. And this is really important because sperm counts have dropped greater than 50% in the last 50 years. So, we've all heard that infertility is on the rise. Well, just don't blame the women. The men are equally to blame. We're not to blame, but it's because the sperm counts are low. Without sperm counts, adequate sperm numbers, you can't get someone pregnant. Okay, so when do we see it? Well, it's SAD, SAD, standard American diet, obesity, smoking, environmental toxins, pesticides, BPA, bisphenol A, That's really a big thing. And vaping, and this is really important. Vape, Vaping is really important, and smoking in general. There's no question. In fact, there's a 2020 study from Finland, 2,000 men, significantly lower sperm counts with smoking and vaping. But here's the thing: irreversible? No, it can be reversible. It will take up to 12 months. So once you quit smoking, it may take up to 12 months before you can really reach an adequate sperm count. Also, tight underwear. Well, I don't know about you. I don't like boxer shorts, but then again, I'm not trying to get anybody pregnant at this stage. So, but boxer shorts are recommended. If you're going through a stage in which you might think about getting someone pregnant, because it's the heat. Okay, it's the heat. So that's why your scrotum is not inside your body; it's outside your body because it's about 2 to 3 degrees difference in temperature than if it was in the body. So that's important. So it's difference in underwear. Heat. Here's a good one. Sauna. Like I love infrared saunas. But maybe if I was interested in getting someone pregnant, I'd be more careful about it because again, it's the heat. No matter what kind of heat, it is, infrared, near infrared, far infrared, it doesn't matter. Heat is heat, and heat can damage sperm. Okay, so again, it starts to be reversible, but it may take up to 3 to 6 months before we see a really decrease in, what with sperm counts coming back. And the other thing is cell phones. Guys, this is really the important thing. Putting cell phones in your pocket is a no-no. It's truly a no-no. And, funny, I never like anything in my pockets. I mean, I don't put money in my pockets, pens, pencils. I always go like a to-me male purse kind of thing because I like my glasses and my wallet, my checkbook. All those things are in a bag, including my cell phone. I do not put my cell phone in my pocket, but I see it everywhere. So a male to put his cell phone in the front pocket, which is very close to the scrotum, isn't good. It's not good for fertility. So, it's not just fertility, guys. It's also testosterone levels have fallen significantly since the 21st century. I mean significantly. I just saw a patient this week, as a matter of fact, and young, healthy looking, works out, and he's a nurse at our local hospital, a tennis player. I mean, mid-20s, and his testosterone level was not low, but very low for someone that age. So normally in men, testosterone levels usually they peak at around 25. It's also true for hormones in women, estrogen and progesterone. But after age 25, we start to age from an endocrinologic standpoint. In women, it can be precipitous, in men, very slow. But this guy was in his 20s, and he had the testosterone level of someone in their 60s or 70s. Why do we see this? Again, toxins, the environment, too much estrogens. Okay, coffee cups, plastic coffee cups. I prefer drinking out of a stainless steel cup. Um, so again, these are all toxins, and your body doesn't like it, and so we would call them endocrine disruptors. So whether it's estrogen and progesterone in women or testosterone in men, the levels are decreased because of these environmental toxins. Again, poor sleep. Poor sleep will kill a testosterone level. And of course, the standard American diet and obesity and lack of exercise. Same answer for all these things, whether it's prostate cancer, colon cancer, boosting fertility, boosting for testosterone levels. It's so much involved with lifestyle, erectile function. This is really a significant problem. And before we jump to that blue pill, what can we do? Well, more 30 million men in this country have a form of erectile function. Now, it can be abnormality in the arteries and the veins supplying the penis, which makes perfect sense, right? And they thought that actually um, erectile dysfunction kind of accompanies heart disease, where you have hardening of the arteries. Well, you have hardening of the arteries of the penis as well as leading to the heart. So it's the same process, just smaller arteries. So keeping the heart healthy will probably keep your vessels healthy, leading to the penis. Okay, very important. So there's definitely a link between erectile function and heart disease. Okay. So what do we do? What's the most important thing to avoid? Sugar. Sugar is an anathema. There's a study out of 2013 that demonstrated men up to the age of 75 who ate 75 grams of sugar, which is a lot, they dropped their test level by 25% over the next 2 hours. Can you imagine? And it's just a sugar load like that. And you know what? It's done too frequently. So, what can help it? Dark chocolate, coffee without anything in it, leafy greens, watermelon. Again, besides having lycopene, which is good for the prostate, also another chemical called citrulline, which helps. It's a precursor to nitric oxide. Any nitric oxide is going to keep the arteries, the penis open and improve fertility and erectile function. Now, what about testosterone levels? This is where I very, we see how can we increase testosterone levels? And we can increase it by lifestyle. I've already given you many examples of what we can do to increase testosterone levels. But eventually, school's out. I mean, just like testosterone, progesterone, and estrogen in women, the hormones will usually plummet. Eventually, you're going to lose them. There's very few men over 65 that have normal testosterone levels. If they do, they usually are athletes that have remained active for many, many years. But the average person is not exercising. In fact, probably no more than 20% of the population is exercising on a regular basis. So most people are going to lose their testosterone levels, just like women losing their estrogen levels as they get older. And then you have to use testosterone, which one of the things I do in my longevity practice is I treat with testosterone. And if you treat testosterone, you have to know what you're doing. You want to go to a longevity expert. And because we have to look at prostate PSA levels, we have to look at estrogen levels, because when we give you testosterone, since estrogen and testosterone look very much alike structurally, but it may convert some of the testosterone to estrogen, which we don't want. It also can increase the thickness of the blood, the hematocrit, the hemoglobin. So when I follow my male patients on testosterone, I always check PSA level, hematocrit levels, and estradiol levels, so that I know what to do when I get that. But prior to that, so what I do with young patients, I have a lot of young patients. So first I work on lifestyle, sleep, exercise, some supplements. It's a good, healthy Mediterranean type diet. And then I also will combine something called HCG and Clomid. HCG is human chorionic gonadotropin, and it's actually a fertility drug used in women. But in men, it can help simulate a hormone called LH, luteinizing hormone, which targets the testicles to put out testosterone. And it can be quite effective. Not in everybody, but it can be very effective. So I can take a person with like a level of 400, which is not low, but it's lower than for someone who's in their 20s or 30s. And I can give them HCG, and it'll tell their testosterone, like a kick in the butt, so to speak, to put out testosterone. Then I follow it with, I chase it with another fertility drug called Clomid. Two together work like magic. I have developed my own protocol over the years that can help take a testosterone level that's pretty low and significantly increase it. When do I want to do that? If the body can produce testosterone, okay, I might want to increase it. Okay, I will do my best to augment it, because once you give testosterone, you're going to shut off a guy's natural tendency to make their own. It's like, okay, I might as well go to sleep now, because there's no need for me to make my own. Get it? No, when you're my age, it doesn't matter, because we don't make the same amount of testosterone when we're younger. But for younger people, I will do my best to kind of work with testosterone, try to increase it with diet, lifestyle, and that doesn't work. HCG and Clomid, and then if I can't do that and school's out and I can't possibly get the levels up, to me it's testosterone. Something else you need to know about, and this came out the study today. We are now seeing plastics everywhere, microplastics. It's in our arteries. Can you imagine? It's in our arteries. We're also finding it in our testicles. Yep, testicles. No wonder fertility is down. But a new study that just read about today that just came out that we're finding it also in the arteries to the penis, microplastics. Now, how can you get it up if you've got microplastics circulating in your penis? This is scary stuff, guys. We're eating too. We're over consuming plastics in our society. Plastic water bottle. I mean, we have to make an effort to decrease because of all civilized countries, we're the number one consumers of plastic, and it's just not a good thing. So, what that's off the press. I just read about this today. Um, there's a lot more. Oh, no one more thing I got to talk about. EMFs. EMFs is also pretty, but I told you, putting that thought in your pocket. No, guys, it's not good for fertility at all. But invisible source of energy like EMFs, basically, it's radiation. It's radiation. We're bombarded with it all the time. So if we can decrease the prevalence of EMFs, we possibly can improve testosterone levels and also improve fertility. So, it's a there's so many things we can do uh, to improve our lifestyle. Sleep is another real big one. I'm kind of going from one topic to another, but sleep is very, very important as well. So really 7 to 8 hours of sleep, and I don't always get that myself, is really important for well-being, for testosterone production, fertility. And I think we've talked about HCG and clomid, and I think I'm going to take your questions now because hopefully there's a lot of them. Let's see what you got here. Okay. Have my thoughts on anastrozole? Yes, it has. Thank you. So, thank you, Dan. Have your thoughts on anastrozole dosing during thyroid? Yeah, the testosterone replacement therapy changed in the last 10 years. So, what is anastrozole? So, anastrozole is an anti-estrogen. I mentioned earlier that when I give people testosterone, first of all, I check all the hormone levels before I give them anything. I check thyroid, I check estrogen, I check everything, free and total testosterone. But you never know how a guy is going to react. So some people are more prone to converting the testosterone to estrogen than others. Because there's an enzyme in our bodies called aromatase, which is prevalent in our fat cells, believe it or not. So that can be stimulated with testosterone, and then again, the body looks is confused because if I put testosterone on the board here, estrogen on the board here, they look almost identical. I can't tell the difference structurally, but functionally, they're totally different. So I was giving anastrozole all the time because we don't like estrogen levels. I used to like my estrogen levels around 20 to 30 for a male on testosterone, 20 to 30. Now I've changed it because there's new evidence saying maybe estrogen isn't that bad because there's two things that we need estrogen for: bone health, brain health, even some sexual health, really. Now, if the estrogen level is really high, it'll kill your sex drive. It'll kill it. But if it's too low, it can do the same thing. So you kind of want a good level. So if I used to treat a level between 20 and 30, that's the ideal. If it was 38, I would treat with an antiestrogen. I'm not doing that anymore. I've changed in the last year. And this was really reported when I went to the American Academy of Anti-Aging Medicine meeting in Vegas in December. So now it's like, I'll watch it even in the 40s. Once it gets past 50, I'll be a little more on the alert. When it gets past 50, I will treat. But it has changed. So, Dan, thank you for that question. Because we're now appreciating the role of estrogen in men, and also as we appreciate the role of testosterone in women. So, we didn't really spend much time on that before, but it really is important. So, thank you for bringing that. That's kind of a new finding. Okay. My workout routine. That's interesting. It really hasn't changed. I mean, I used to compete. I don't anymore. I competed from about 1998 to about 2000 and I forget 2000. What I think 2012. Because for a few years I was a late comer. I mean, I was always a strength athlete, but I was a late comer. And then I started working out I used to do triathlons and aerobic stuff, and I'm totally not built for that. But I did it until I got so injured I couldn't do it anymore. Then I got turned on to a trainer. And he said, "You got the genetics for the sport, so you should compete." And I really wasn't interested in it. I said, what the hell, I'll do it. And I competed and placed the first top five in my first contest. Then I was hooked. But I still train, even though I don't compete. When I go in that gym, I have one mindset. I leave all my crap at the door. I do not enter with a negative mindset. And that's it. I give it my all. And it's arms are easy for me. Okay. Because I was a gymnast, I had to really work on the legs, but now they're pretty equal. But I also had back surgery I had two surgeries, one in 2000 and 2008, Friday the 13th, 2008, which gave me permanent nerve damage. I had a total botched up job. I was 8 weeks out from a national level bodybuilding competition, and after surgery, I couldn't walk one foot. The first 3 days in rehab, basically, went from sitting to standing with a walker. Guys, it was horrible. Then I not only was it botched up, it was also incomplete. So I ended up with a second surgery January 3rd of last year, thinking that it's not going to correct the nerve damage, but hopefully it'll make me feel better. I'll be more functional. It didn't work. In fact, I'm less functional now than what I was before. I mean, I struggle with stairs. I can walk, but I'm really limited. I can't dribble a basketball on the court with my grandkids. But that doesn't stop me. I still go in that gym 4 days a week, 3 days at a local gym in Whittier, and go to some in Venice. So my routine and the figure and the mindset never changes. So that's the important thing, guys. Consistency and never giving up. That's how I do it. Thanks for asking. Um, what's the best way to build muscle mass efficiently? Okay, well, and also the best way to boost testosterone. Well, the thing with boosting testosterone levels, we talked a few things. One is I didn't mention zinc. Zinc helps. It's also one thing I left out: ALC, acetyl L-carnitine, which is one of the carnitines that actually it goes to the blood-brain barrier. So it's kind of important, and it can increase. It's actually good for depression, and it can help with erectile function and testosterone. But you got to get something like 2 grams a day. So you need kind of a big dose, and so that's one thing you can do. The other thing is just diet. A low carb, high protein diet. Nothing magical, and all the things will help. Adequate sleep, so it's kind of a multifactorial thing. A healthy lifestyle will help maintain. I mean, I have some patients that have really good levels of testosterone because they've been consistent with their lifestyle. As far as building muscle, you need protein, you need consistency, and you have to really push the weight in the gym. And what that means is if you can do like 15 or more reps, the weight is too light. So you want to do more like 8 to 12 reps that we usually look for. So that's a whole different topic. I'm going to get off the subject. But anyway, let me see what else is here. Um, pardon me, they're working on the roof now. Can you believe it, of all times? Um, okay. Strength training versus cardio. Okay. Great question. Thank you, Louis. Okay. I'm going to be upfront, you guys. I'm a cardiologist, and I'm all about cardio, right? If you're 55 or older and you only have time for one type of exercise, make it strength training. Why? Because strength training or muscle building, muscle is your organ of longevity. Now, who ends up in nursing homes? People that can't open a jar, they can't shut a window. They've lost the ability to do what we call ADL, activity of daily living. Like my mother is 98 years old and she's pretty with it, okay? She's had little problems the last few months, but she can't do anything because she hasn't exercised in years. And she was living in Florida with my two sisters who didn't help encourage her to exercise. My brother and his wife brought her out here 3 years ago. But by that time, everything was set. She was what? So 95. So it's really keeping fit. And that's the important thing. So if you only have time for one type of exercise, it should be strength training. And everybody should be doing some strength training twice a week, if not 3 times a week. If you don't want to work with weights, work with resistance bands. Get yourself a trainer. Learn proper techniques so you don't get hurt. That's it. Cardio is also very good. I am not an aerobic athlete, although I did try to be one. But I want you to know that I trained And for I didn't made for Japan, I did a VO2 max test, which is a very difficult test to prove how much oxygen you can consume in your muscles. So it depends on cardio, your heart, respiratory, your lungs, and your muscle being able to extract oxygen. And I trained like about 2 months for this, and I got like a score of 41. Now I wanted to get closer to 50, but 41 for my age group is like the 90th percentile, and I'm not a Olympic athlete, but I trained for it. So cardio is good. Cardio is beneficial, but strength training really is most important as you get older because you have to have muscle. Great question. Thank you. Anything else? And I want to really end on this whole thing with plastics because in the last few weeks I've read all these stories about how detrimental plastic is, but we're just a matter. We're seeing it in our arteries, so our arteries to the penis, our arteries to the heart. Okay, and we're also seeing it in testicles, so it's going to affect testosterone production, also erectile function. It's an anathema for a male who wants to be active sexually and reproductively. So I think we all have to really figure out how we can do with less plastics in our life. I'm gonna try to use, stainless steel drinking cups. I try to bring this with me or something like if I go get coffee because they're gonna give you a regular coffee cup. I brought this here so you could see it. Okay, it's lined with BPA, bisphenol A. Toxic. It's really bad. Okay, let's see what else is here. Thoughts on ketone drinks. I have not done a ketone drink. Now, I want you to know that personally, I think ketogenic diet can be very helpful for those that are overweight, metabolic syndrome, diabetes, also help with early dementia because the brain really does well. The brain is 65% fat, by the way, so it thrives suppressing the fat. Does not do well with carbs. Also, various cancers. So I have used ketogenic diet on my patients. Although I'm not ketogenic, I have a pretty much low carb diet most of the time. And when I do something called FMD, fasting mimicking diet, which is a whole different topic, if I'm on that diet, which limits your calories for 5 consecutive days, by the end of day 2, I'm in ketosis, which means I have taught my body to be able to be flexible. So I can go from sugar to ketones for energy, which is really a good thing. Because now I haven't done one since my back surgery, which is actually almost 2 years ago. I did 16 cycles of a fasting mimicking diet. If you want to read about that, it's Volter Longo, Longo. It's very good and very effective for losing weight. But and it's you do 5 days of very low calorie diet. It's all in a box. It's it takes a fair amount of discipline, but you can do it. And it'll help to make you lose weight. It'll also do what's called autophagy, which helps you eat up cells that need to be gotten rid of. And it can be, it made me metabolically flexible. I mean, if you look at my family genetics, it's not. I mean, like my father's side, take it to my father's side, they were bigger, boned, okay, but they all got fat after 40. They didn't exercise, they all smoked, but so I probably would be fat if I didn't do what I do. But I've always done it. I've never not been active. Again, it's about consistency and same thing with the diet. So a high carb diet and high junky carbs and sugars and fats, not the way to go. Healthy fats, yes. Eggs, yes. Avocado, yes. Nuts, all those things are healthy. So as far as the ketone drinks are concerned, I've heard some really good things about it. And they can help you, especially toward the end of the day. There's something else that I take called berberine. I'm sure if you've heard of berberine. It's kind of like a metformin, but it's not really a drug. It's an herb, and it can help reduce your cravings for carbohydrates and improve your fasting because we really want to cut down on late night eating. That's bad. Okay. So after dinner, I have a fruit for my dessert, and that's it. I used to love to snack, ice cream or whatever. I really avoid snacking most of the time. I don't have that craving anymore, but I do take alpha-lipoic acid with my last meal, which helps. And I think the ketone drinks would be very useful there. So I personally don't drink them, but people that do have really benefited, and it does help to keep you in ketosis when you need to have it if you want to go ketogenic. Again, it's all about training your body to be metabolically flexible. And I mean, really, I'll be honest with you, guys, without trying to get bigger or get smaller, my weight is more than 3 pounds. I mean, it's amazing. My weight's never been this stable, ever, except when I died for a contest, and that wasn't healthy. I would lose 30 pounds in 12 weeks. That's crazy what I did back in those days. But you do what you have to do to win a contest, right? I would never recommend that now. So now I just eating sensibly, Mediterranean. I'm kind of between Mediterranean and paleo, and I try to avoid processed foods as much as possible. And by the way, you have to know this. Did you know they spray glyphosate in anything that's put in a box or a bag? So I don't think it's just in crops. Chips, crackers, they're sprayed with glyphosate, which is Roundup. And that's a killer for fertility, erectile function, everything. It's just we are bombarded with environmental toxins and endocrine disruptors. It'll kill estrogen and progesterone in women. It will kill testosterone in men. So anyway, these are topics I love to talk about. Let me see if I get anything else. We talked about what to do. You can boost your testosterone naturally, but keep in mind, after a while, like I said, school's out, and you will need to actually take testosterone therapy. But I generally try with HCG and Clomid first. If a person can produce the testosterone is 150, it's pretty low likelihood I'm able to boost that. But if it's like 350, 400, it's on the lower side, but maybe I can boost it with the HCG and Clomid combo. And I've been very successful with that over the years. I have my own protocol that I made up. I should patent it, but I haven't. Because, so a lot of the patients I deal with, I can boost their levels with HCG and Clomid. But again, once they get really low, just like in women, we need hormone replacement therapy. And I think whether you're a man or woman, we look better, feel better, and think more clearly on hormone replacement therapy. It's changed over the years. Whether you're a man or a woman, you need to go to a doctor that at least offers you the option to go on HRT, because it's going to help your aging process, whether it's muscle building, brain clarity, and bone health. There's nothing out there that's going to preserve those qualities, those anti-aging qualities, other than hormones. I don't care what anyone says. So keep that in mind. I think, I think I got everything here. Yes, I think we do. Guys, thank you so much. I'm so glad. I was really worried about tonight because I didn't realize it was a debate until like an hour before. I said, oh, no, but I just figured, okay, who's been to watch this will watch it, and if not, it's still on YouTube. It's just not live. So if you have people that might be interested in this, tell them just go on my YouTube channel and they can see it, because I think it's important. And that's just for Men's Month. And I'll see you next month. I haven't figured out what July is, but we'll figure it out. You guys are very welcome. Thank you. I enjoyed it. Thank you for joining me. Well, I don't have any women today. This is great. I think everyone that's asked me a question is a male. That's exciting. Because like I said, when I started off as a young cardiologist in the 90s, late 80s, early 90s, it was all women. That's how men got into my door. Women dragged them in. So it's changed, and I appreciate that. Thank you, guys. One little plug. I forgot to tell you. Look, my book. So this is my story, but it's more than just my story. From both sides of the table, it's really how I became my own medical advocate, and I did it by being hospitalized not once but twice in a span of 19 months. And I learned how it was to kind of pull on the reins and take care of myself. And this is what I do now as a doctor. I want people. My passion is to create other medical advocates. You don't have to be a doctor or a nurse. And this book will tell you how to do that. Okay, thank you guys. Good night, and appreciate your help. We'll see you next month for another episode on YouTube Live. Thank you, guys.